today. We are very happy to have you join us in our inaugural session. And it's my pleasure to introduce to you our moderator for today, Dr. Christina Kadama. She's a retired doctor who's passionate about aging intentionally. And more importantly for me, I get to call her mother. Dr. Kadama has practiced medicine for over 30 years prior to her retirement. And even in her retirement, she continues to be an advisor to many regarding medical issues, and is still an active member of her community, an active grandmother, very engaged in the care of her grandchildren, and is also a member of the Uganda Medical Association Circle Board. Dr. Kadama, for me, is one of the definitions of purposeful aging, and we are very happy for her to be our lead moderator for this inaugural session. Please join me to welcome Dr. Kadama, our moderator for today. Thank you. You're welcome, Dr. Kadama. Okay.
You're muted.
You're muted. You're muted. We can't hear.
Thank you very much, Dr. Makanga, Philippa. I'm blessed to call you mom. Mom of my grandchildren. And as you've said, it gives me much pleasure to be with the grandchildren. Welcome everybody on board, my fellow seniors and caregivers. You're most welcome to this wonderful session. I'm privileged to introduce a guest speaker this morning. The topic has been introduced, mental health for seniors. We have with us Professor Noeline Nakasujja, MBCHB, M.Med. Psychiatry, and PhD Psychiatry. She's an associate professor of psychiatry and a current head of the Department of Psychiatry in the at the College of Health Sciences, Makerere University. Professor Nakasujja is an expert in the field of geriatric mental health and psychiatry. And for maybe the caregivers, you might want to know geriatrics is to do with the aged. I'm sure she will explain all that to you. She also sits on the board. She chairs the Uganda Society for Health Scientists and is also on the board of Alzheimer Association of Uganda. Professor Nakasujja, you're most welcome to this session. You have 20 minutes to give us all we need to do and to excite us into the journey of aging. For the rest of you, after the professor's 20 minutes talk, we shall go into question time. And as you've been warned, please put all your questions in the chat. We'll endeavor to cover all of them within the 20 minutes given to question time. And if we do not cover them, we'll try to cover them directly to you at a later stage. Professor Nakasujja Noeline, you're most welcome.
Thank you very much, Dr. Kadama, for that very nice introduction of myself. I request that I'm given sharing rights so that you can see my PowerPoint presentation.
You do have sharing rights.
Okay, so in a minute. So, Atina, let me know if you're seeing it well. Okay,
yes,
good.
We can see your
so,
screen.
So to all that have logged in here today, it's a great pleasure for me to be speaking to you about minding the gap, mental health for seniors. I understand this is your first session in this series. But I was given a rather big task to talk about such a huge topic in a rather short time. So if I rush you through some of the things, please do not take offense. We could always revisit deeper each of these topics as may be necessary. So I was introduced. I work at Makerere University, but just so that we are all on the same page, I need for people to be clear of who we are talking about, who is old, who is senior, who is an elder, who is an older person. There are so many words that I use to define this group of individuals, but there are also some standard definitions. You just heard that Dr. Kadama retired. I don't know whether she retired as per the United Nations definition of 60 years or the WHO definition of 65 years. But whichever it is, especially for Uganda or other low resource countries, the age is usually taken at 60 because of the life expectancy, which for a long time has been a low one in many of our African countries due to various issues like wars, infections, where you'd find that many people are dying younger. But I'm also glad to note that the recent estimated life expectancy for Uganda is now at 63 years, which is a good thing, but that it also comes with challenges. So it is important for people to age well and continue to be functional even in their old age, so that they can be able to meet their basic needs, be able to be mobile, engage in activity, contribute to society. The older adults usually have a lot of wisdom, they have a lot of knowledge, and it is often required that we continue to benefit from that which they already know, and they continue in building society, and it's important for them to maintain their relationships with other people as they age. Now, there are some myths I just want for us to clear through this talk or through the question and answer session that we'll engage in after my talk. Number one, it is not normal for people to develop depression, cognitive impairment, or confusion because of being old. It's not normal. If you see it, know that there's a problem and it needs attention. If you see any person who has cognitive challenges, it doesn't always mean that that person has dementia. And you will get to see that in a few of the slides that I'll be able to share with you. It is also not true for people to always assume that older people may not have drug-related problems. In our setting here, it's usually alcohol. And that if you find an old person who is grieving because they lost children or they lost their spouses, it's not normal for them to be feeling that grief and pain. If you're seeing it, it means there's a problem and that person needs assistance. And then, of course, because we live in, especially in Uganda, where we have high rates of HIV, many times people don't ask questions that are related with sex for these older adults, assuming that they do not engage in sexual activity and that they may not suffer from STIs, sexually transmitted diseases, or diseases like HIV. And it is so wrong. For those who are online and maybe medical professionals, it's still important to ask questions related to that. So why are we concerned about seniors? Why are we talking about them today? Now, there's a terminology, ageism. Ageism is the tendency for people to look at individuals who are older in age and making presumptions of what it is that they can and cannot do as a result of their age. It is a discriminatory way to look at individuals in this way, because then people tend, or society tends to sideline them because of ageism, assuming that they cannot do certain things. And as a result, they end up losing a lot of sense of purpose, since they can't be included in decision-making, engagements, and given opportunities to work or perform in certain areas. There is always the issue of financial insecurity when people retire, especially if they've been in formal employment, that the income that they had streaming in now gets cut off, and that brings a lot of challenges in how they are able to look after themselves, as well as look after people who may be under their care. There's always challenges in finding money for healthcare, especially in our setting here where there may be no insurance that may cover all. There's always a challenge with difficulties of day-to-day tasks, as well as mobility, because our speeds are slower. We may be aching here and there. There's always a challenge in finding the right carer. If you have hypertension, if you have diabetes or other ailments, it's usually a challenge, especially in our setting where we do not, it's up to you to find who you would like to, offer you care. And of course, the access to healthcare services, for people who are in Kampala, that may not be such a problem, but people who live out in the community or in the villages sometimes have to trek long distances for them to be able to access these kind of services. And of course, we do know that as we grow older, we lose people along the way, and that creates a challenge in creating more isolation for these individuals when their loved ones die. And there's always the fear for people to make end-of-life preparations. People don't like to talk about death. They don't want to plan for that eventual end, but it is important, if you want to have healthy aging, to get these things in order, because it gives you a peace of mind when you do so. So significantly, the population, what I want you to pick on this graph is that when you look from the 1980s up to now, the bar to your, which is to my right, that is shaded dark blue, this bit has steadily been increasing as you see us go through the years. And when it comes to Africa, the continent where we live, this number of individuals is also steadily rising, just like other parts of the world. But more alarmingly, the increase of older persons is especially for in low and middle income countries. The other high income countries already have their older persons, they already have services in place to kind of cater for them. With Africa, which is in the green here, or other Africa, which belongs to the green in here, that rate of increase is very rapid in our setting, and there's hardly any services that we have ready to cater for this increasing population, because their needs are rather different. So let me quickly go through some of what happens to people as they age. I prepared these slides with what I wanted to share with you, but some people also asked a few questions before, which I've tried to answer in here, but only briefly because they are rather very huge topics. So when we grow older, our brain cells die and they're not replaceable. However, the rate of death of these brain cells is a very slow one. But by the time people get to about 90 years of age, there's significant reduction in these brain cells that would lead to the impairments that we are going to be seeing. So what I'm talking about here is the normal one. I'll talk about the abnormal aging a little later. So there's also a decrease in neurotransmitters or brain chemicals that allow for brain messages to be passed along within the brain for us to be able to function normally. But as we grow older, these decrease, and significantly so for the one that we call dopamine, which is very important for our motoric activity, how the way we move our hands, the way we move about, as well as, how we learn new things that are around in our surroundings. So I put a cartoon here of this gentleman who is asking now, am I going upstairs for something, or have I just come, down to get something? So this is a very common thing that you will find, especially for its short-term memory. It increasingly becomes a challenge for us to remember things that have just happened in the recent past. That's what we call short-term memory. But also as we go along, as we age, we also get challenges with our episodic memory. Episodic memory is that which helps us to remember things that happened at a certain time, or the sequence of events that may have happened previously. So we start to mix up these things and forget things like dates and appointments. Challenges come with verbal communication skills, that people may not be able to remember what they are supposed to say. The cartoon here shows this gentleman wondering what it is that they were about to say. And yeah, this increasingly becomes a challenge, especially as people get over the age of 70. Our reaction time becomes very slow. We do things slowly, and I think you have observed this as people grow older. So with that I've just mentioned, some people may be saying, is what I'm having normal aging, or is what I'm seeing in my loved one at home normal aging, or is it a sign of dementia? Like I said before, the biggest fear that people have is usually around dementia. And this chart here shows that sometimes there may be differences in what you may be calling dementia and what we may consider as normal. I just want you to note that we are able to note, if you came in for medical care, that we are able to note that there's a difference between how these two may manifest. So on this slide, I just want for you to pick that as people grow older, there's an increasing fear for health problems. They have these fears within themselves. So if an individual or a caregiver is with this individual, it is a justified fear, because we know that people get these things, and that's why it may be good for people to have checkups, maybe on a yearly basis, for the common conditions, hypertension, diabetes, a screen for cancer illnesses. But also we know that individuals become very stubborn when they grow older, and it's very difficult for caregivers to make them change their minds or change their routines for things that they were already used to. And please, if you're a caregiver, just move along with the older person, because it's very difficult. So there are many mental disorders that occur as we grow older. I just want you to know that the commonest one is depression. There are others like anxiety, other severe mental illnesses people may have had before, alcohol abuse or substance abuse. There's always the fear of suicide for individuals as they grow older. And of course, the dementia, as we've talked about. Now, many times individuals have a lot of other physical ailments that may also bring along mental health challenges. This is what this slide is saying. So diseases like diabetes, Parkinson's, urinary tract infections can also bring on mental health problems for these individuals. Nutritional deficiencies, when people get fractures and immobile, sometimes they will end up with depression or delirium. Sometimes the medications that are being used to treat the conditions that these individuals have again, sometimes have side effects that can lead to mental health problems. The lists are very long, but I just want you to be aware that this can happen. So, and then of course, there are risk factors for things like depression. Females are at a higher risk than males. People who may not be in a relationship or who are very living alone, unmarried, if they have other physical illnesses, if there's a family history of depressive illness before, individuals who lack social support are also at a big risk of having depression. So one of the questions that people had posed to me before was the issue of how to deal with stress, loss, and disappointment. When, as individuals, we have a range of emotions, as you're seeing on here. We may be happy sometimes, we get sad other times. We may have joy or fear. When it comes to disappointment, disappointment is a definition of that which we feel when we have been either angered or been let down, or when we lose. Someone may have to mute. Moderator, help me.
Mr. Makerere, do you want to mute your mic, please? Please mute your mic.
It is missed.
Okay.
They've muted.
Okay, great. So, so the issue, this person wanted to know how to deal with disappointments that come, not only for older persons, but even for people who may be younger. It is important for you to kind of let this thing pass. How do you let it pass? Talk to someone, talk to a family member. You can talk to a therapist if you're in therapy. You could try to write it down to get it off your chest, or you may try to do something physical, like take a walk or engage in some other activities, so that you're giving the opportunity for this to pass. Get a perspective about that thing which has caused you the disappointment. See others' views about what it is that has caused you disappointment, and know what is in your heart, and stick to your values and your principles as regards what that disappointment is, so that you don't get to feel like maybe you're being unfair in making judgment about whatever it is that may have caused you this disappointment. And then, of course, eventually you may have to accept, because there are things that may not be able to get changed as a result of whatever has happened, and you accept it for what it is, and do not make it any worse by ruminating over it and refusing to let go, because if you cannot really change what happened, it will only cause you more distress if you let it continue to worry you. I'm going to skip some of these things in the interest of time, but I just want you to know that there are many types of conditions, like I showed in a previous slide, that when it gets to dementia, we have many different types of dementia, and there are different causes for this dementia. Much of it may be genetic, but some of it is because of other conditions we may be suffering from physically. Excuse me, please, just need to close the window here for noise. So the risk factors for Alzheimer's disease, like I said, there's a lot of genetics. So a family history increases the chance for people to develop this. chronic illnesses like hypertension. And as I mentioned, there are many different types of dementia. I'm not going to the details of that, but some of these dementias are treatable, unlike the previous ones that I just flashed. A dementia that may be coming from chronic drug use like alcohol, dementia that comes from tumors or vitamin deficiencies is also treatable if you were to get the individual into care. It was mentioned earlier that I'm a member of the Uganda Alzheimer's Association, and because we did notice that there is an increasing number of people who are suffering from dementia, it is important to have an association that offers support to caregivers, and I would invite you to join us. Whether you do have someone who with dementia or you do not, you're welcome to join this association. So in the last few slides, I'm going to talk about how to protect our brain. Sorry, I apologize. Someone is flashing. I'm going to have to ask them to kind of move somewhere else. 1 minute.
I think members, please, if you're stimulated, remember to put your comments, your questions in the chat, because our talk is about to end and we'll be going into question and answer time. And for those people, members who have videos on and busy with other activities, kindly switch off your video and make sure your mics are muted for the comfort of our guest speaker.
I apologize about that. We have a few slides to go, but now we're going to how to protect our brain health. And what one has to strive for is healthy eating, regular exercise, keeping your brain active, maintaining social connections, and getting enough sleep. I'm going to go into the details of how we get to do this. But importantly, getting enough sleep. I mentioned earlier that our brain cells die as we grow older, but it is also very important for the brain to refresh each time we go to bed. So it's important for people to sleep. Now, I'll begin with how much can we drink? I know we are in Uganda, and it's not a good thing that we rank high as people that consume a lot of alcohol on the continent. But I think it is important to also note that alcohol is a social drink and many people take it anyway. So better to give guidance on how much it is that they can take. And this is a guide of how much you can take as an older adult. As you can see, it is only no more than 2 to 3 drinks on any drinking day. And only 1 drink on a standard day. It is important for people not to smoke. That, and campaigns against smoking have, I think yielded a lot in Uganda, but for all adults, even more so. It is important for people to exercise. You can do stationary exercise if you fear to go on the road. For example, you can spin at station. It is important to eat healthy. Some people may say they have inability to move, you could still do exercises while seated. For those that are mobile, you can go out and do that exercise. It's important for you to keep mentally alert. Read a book, read newspapers, practice crossword puzzles. There are special ones that are for seniors so that you keep mentally alert. It is important for us to maintain social connectiveness, join with other older adults, and for those that are on to this presentation today, In Uganda, I know the commonest place we may be able to go to is, say, the church. But if anyone is willing, with the increasing number of older individuals in our community, to put up spaces where they can come, maybe do art, play games, you know, engage in activities here and there, that would really be very good for our community. I've seen it happen in other places that I've happened to go to. And to the question of how we deal with loneliness, this would be a good way to take away the boredom one might have if they're living by themselves. As you see this very isolated older person who oftentimes you may find is living all by themselves, and it's really a very hard thing to go through. So if you're caring for an older person and you want to decrease on their loneliness, talk to them, have a plan for them to engage in some activity, teach them something new, or try to allow them to teach you something they may already know. Many times they have a lot of knowledge about things, and keeping them active and engaged is a good way to help them with the loneliness. And then Dr. Kadama talked about grandchildren. We bridge the gap. We connect with younger ones, so that you keep these people alive. They may be, you know, grandchildren, nephews, anyone. Keep connected to younger people. And then the last one is on the issue of you preparing your end of life plan documents. It is very important. Many people are afraid of it, but it is important to put your paperwork in order, to avoid conflict for your family while you're alive, or even after you may not be alive, so that you age gracefully. Now, the other one question an individual asked is, are there any public services to help individuals with loneliness or generally the problems that come with old age? The one thing that the government had tried to put up through the Ministry of Gender was this social empowerment grant for old people that was really mainly looking into finances for old adults. What you see here is when they've come to pick the 25,000 that they were being given every month in a couple of districts within Uganda. It is not in all districts. The government was meant to, you know, scale it up to everyone. However, there are challenges with it. We had aid that was coming from UK aid and Irish aid, but I think their bit is now done. And yeah, we need a lot to be done in this area to improve services for older adults, not only financially, but also in organizing things within various communities. I will stop here for now. I know a lot more that happens with various older adult groups, but in the interest of time, I'll stop here. Thank you for listening to me. Back to you, Tina.
Thank you very much, Professor Nakasujja. This has been a very stimulating 20 minutes. I'm sure many of you are having burning questions with you, and we have a few minutes to go through the questions. I'll start off with a comment about myself. I actually retired before I was 60 years. I became 60 when I was in retirement, and I am proudly 70 this year. I have learned a lot. You have been talking about me all through the 20 minutes, and I'm sure that's the feeling among many of you. And I think that is the basis of our continued hearing from each other, coming together as we've been advised. I will not attempt to summarize the talk. It will be very unfair. Otherwise, I'm just going to let you ask questions. Some of the questions have been in the chat already, and I am going to read them out. The first one was a comment from Dr. Tegu. Dr. Tegu, thank you for appreciating the 20 minutes, been informative and very provocative. And there is a question from Millie. She wants to know, Millie Kwagala, Dr. Millie Kwagala. She wants to know, how do we become members of the association Dr. Noeline has just mentioned? Then Dr. Helen Anyu would like to know, does any daytime sleep, napping, help at all in brain health? There were many other questions to do with sleep. What can older people do with the sleeplessness which seems to disturb them? Can Dr. Noeline try to answer those three questions right away?
Okay,
please.
So, yes, how do people become members of the Uganda Alzheimer's Association? So the current chairperson of the association is Professor Semakula Chiwanuka, and we have a website. Joining through the website is not a possibility at the moment, but I can share joining information with this group here now for you to register as members. The registration fee is really very minimal. That would be aimed at organizing activities to talk about, issues to do with old age, to tell caregivers how to deal with the difficult behavior that usually comes with individuals that have Alzheimer's disease, and linkage to care and the rest. So I will share that information with you. Does daytime napping help? Yes, daytime napping for older adults, sometimes they become like babies, the way you let a baby nap, for as long as you know it's not going to interfere too much with their nighttime sleep. It is okay for them to nap maybe for 30 minutes or 40 minutes in the afternoon as may be required. Now, insomnia is a big problem. That is the lack of sleeping at night for older adults. And for much of the time, we encourage the things that I talked about earlier, engaging in activity, eat healthy, avoiding things that would result in more challenges sleeping. For example, taking coffee rather late during the day. Once you're done with that and still it is not helping, then we do not very much like to give medication for older people to go to bed. But if necessary, then we may have to normalize their sleep, but also to keep a routine of when do people go to bed. So much of the help comes with sleep hygiene first before we go into medication. But also to note that when individuals have Alzheimer's disease, then it becomes a challenge, and we just have to do something about it because they will just not sleep. They'll keep up the whole night packing bags and hoping to be going somewhere, and it creates a lot of distress, not only for the individual, but as for the family as well.
Thank you very much, Professor. This question of going anywhere is a serious one because many of our elders do walk and are never seen again. I think we'll learn more about that later. So when they pack their bags, you better be on the lookout. Isaac Onyoa would like to know, how do you deal with a senior who is seclusive? And I think the other question I'm going to, not a question, but a comment, how can we get a soft copy? I think if you registered, your email is with us and we shall keep in touch with you. as you were told at the beginning. Professor, could you answer that senior who is exclusive? How do we deal with that?
I prefer, I didn't get the name of the person who asked, but now would this have been from before? I wish they could clarify a little bit that this person has to be themselves, or they are by themselves, and how do we help them? Because the answer could be two-way.
Can Isaac unmute and clarify on that? It's simply, how do you deal with a senior who is seclusive?
Thank you very much. My point on seclusiveness comes in relation to therapy, but now you get to a situation where the senior, yes, he's just oppressed, but at certain point he just doesn't want to do things, and he's not even staying within him. He prefers to take another lead. But also when he's in the sense of lot of things. So that is my advice. Thank you, sir.
Okay. I was not able to hear. I was not able to hear what he asked. So let me just give answers that would cover what he may have asked and what he may not have asked. So if there's seclusion by choice or not by choice. So one of the things that we talked about in the presentation was the loneliness that comes not out of choice of the individual, but because their loved ones have died, they've lost friends, they've lost income, they are by themselves, in which case, then it is us, the caregiver, to reach out to this individual to take them out of that seclusion. Right now in Uganda, it really all depends on us, the caregivers. It all depends on the family. So family members, please visit your elders. Make a schedule to ensure that you check on them every so often, talk to them, call them. I know there's lots of increasing gadgets within the community. Get them, a phone where you could video chat with them, or even just telephone call them to keep them active. Look into the community and see how they could engage in activities like going to church, whatever activity that may be happening wherever it is that they are, so that they get out of that house. Take them for some outing sometimes, as you may be able to take them out of that seclusion. So for much of the time, it is us to help reach out to them. Now, if a person was not originally seclusive in their behavior, and now that you notice that they don't want to associate with others, it may be a sign that there may be a problem with them, and it may be good for you to see if you can get them into care, because as I mentioned earlier, depression is the biggest problem for older adults, and sometimes they may be depressed and they need care and for us, people isolating themselves is a sign of mental illness for some of them. I'm not saying everyone, but it may be a good thing for you to have them evaluated. Over.
Thank you, Professor. There are many questions still, and I'm afraid we are running out of time. I would like to beg this audience to give us an extra 10 minutes past the hour so that we can cover the last 3 parts of the program. And before that, can I ask all of you to give a thumbs up for Professor for the elaborate, informative, stimulating talk for the last 20 minutes. But before she finally checks out, there's a question which I think we need to hear from her. The question is from sorry. How do you handle a senior seniors who have failed to give up womanizing even in 70? By Rose. You could quickly summarize an answer to that question, and then we can give a thumbs up for the elaborate presentation before we go to the next stage.
Right. So let me be sure that I'm assuming this person has, whatever they mean by womanizing, has always engaged in this behavior. So womanizing definition: the engagement of an individual in numerous sexual affairs with women. If this has always been the individual's way of life, it may be a bit of a challenge. Because once we have individuals' personalities formed, it takes a lot to change the way individuals may view things and the way they do stuff. However, when people engage in such activities, of course, you're concerned for their physical health and any consequences that may arise. For example, if they provide them with condoms to ensure that they have safe sex. That's the thing I talked about earlier in the beginning, that sometimes some people actually do continue to think that older people do not engage in sex, but they actually do. So ensure that they practice safe sex. Ensure or talk to them if at all they are getting into other people's spaces or crossing borders, getting other people's women, that I mean, this could end up in very catastrophic ways. They could end up being beaten or, harmed in other ways. So talk to them about those kind of things. But at the end of the day, talk to them. Talk to them if they are your father. Talk to them if they are your uncle, and ensure that they stay at least healthy and alive, that they practice safe sex. Thank you.
Thank you very much, Professor. I would like to go on to the next speakers. We have two speakers, just to give a wrap up in about 1 or 2 minutes each about the whole session. The first one is Dr. Jane Kavuma, senior retired doctor. And then she'll be followed by Mr. Dan Sengenddo, a person who has gone through caring for a loved one and is himself a senior. So we just want to get a feel of the two in 5 minutes, please. Dr. Jane Kavuma, please unmute and address us.
Hello, can you hear me? Hello?
Yes, we can. Loud, yes, we can.
Actually, thank you very much, Dr. Christine Mugwanya, and your team, which has organized this series. It's a very interesting, but it concerns all of us, because at one time we will become seniors. Me, I'm a senior already like you. So it concerns all of us. At one time or the other, we have to go through or to care for people who are aging. I must thank also those who are attending and listening to it today to have spared their time. And I also thank very much Professor Noeline and Nakasujja. She was given a very short time to cover a very broad topic, but at least she has been able to outline at least the myths
Hello, Jane. Have we
the
lost
myths about, we are sons, all of us, yes, that we are in Uganda, in the 65 and 65 plus, we are about 1.99, but the number is on the increase since the life expectancy now is 63. So we have to be prepared. And we have series like these will eventually turn out to demand the government to do more for the elderly. And as we know, the global population of those 65 plus is, as we have been informed, is growing up and growing. And Professor has even outlined that we need the risks of not having healthy aging and how we can protect our brain health so that we reduce those risks. And I think since I've got very little time, that is all I can remember, and that is all I gathered from her. But it's been a very informative and educative first series. And at the same time, I would like to thank all of you who have attended this seminar webinar. Thank you very much. Over to you.
Thank you very much, Jane. Thank you very much. Can I call upon Mr. Dan Sengenddo to give us a few words of what he has picked from this 1 hour?
I thank you, Dr. Kadama, for this session. It's very, very healthy and educative.
Could you unmute? I think you muted yourself.
I remember when I lost my loved one, she was down for 3 years in hospital and in a coma. She was in a coma state. But after 2 years, she in international hospital. After 2 years, she came out for a month. And when she came out for a month, she prepared herself further. I only realized that when we lose our loved ones, they go away in the body, but the soul remains with us. And the soul of my loved one, I live with it. I remember two years ago, on the night she left, she died 2nd May, but during the night at 3, God brought her in a dream to remind me about it. She, in a dream, she came to me. She knew I was forgetful. She told me, Dan, do you remember when God took me away from earth this day? Do you now realize it's coming to 7 years? And she gave a prayer that God should continue to help me. I was surprised. I was very happy. And that I realized that people go away in bodies, but their soul remain with us. Me, I live my life. I am with my children. I live with the eldest one, Dr. Grace Kisitu, and the young one, Stephen Sevagara, and they're keeping me active in all ways. I am happy about it. Thank you very much for the session. And I realized some time back, I used to go to activities like exercises, it helped me. There's a group there was a group I used to go to, and we are gathering, and it helped me for a period. And I am participant in church activities every Sunday, and I'm happy about it. It keeps me going. Thank you very much for this. I've learned a lot. Particularly, drinking and smoking is very, very important. Thank God I wasn't a practitioner in those activities. Thank you very much.
Thank you
Dr.
very
Kadama.
much, Mr. Dan Sengenddo, Senior. We have managed to witness some of the effects of aging as were elaborated by the professor. Dan was very slow in his speech and all that, but a bit of patience on our side as loved ones and caregivers and as professionals. And he has picked a lot from the talk, like exercising and other habits. Once again, I would like to appreciate the professor for the talk. It's been broad, and as she clearly pointed out, it was far too big for the time we allocated for her. But this, since is the first session, and I'm sure all of you have registered and you are going to continue inviting others who may not have made it today. I just want to end up by encouraging you to keep in touch and let's move together, age gracefully together. Thank you so much for the time you've given us. We've been honored. We are privileged to have had over 70 people for the last 1 hour. I would like to hand over back to Dr. Makanga to close up the session. Someone is unable to register through the link. Isabella, could you just put your email in the in the chat, please, your email and your telephone contact. Thank you. Bye.
Thank you very much, Dr. Kadama, for moderating this session. Thank you, Professor Nakasujja, for the words of wisdom you've given us. Thank you to all our participants for coming and staying with us all through the 1 hour. We cannot say thank you enough, but we'll keep saying thank you, thank you, thank you. And we'll ask you to leave your email or register if you haven't registered through the link, so that we can get to you with more information about this topic and even other topics that we shall have for discussion in the future. We intend to have more of these talks. This is the first like you had before. And we look forward to working with you on this journey. Please feel free to share with us anything that you have that you'd want to have shared through this forum. And we really just want to say thank you. Let me not bite my tongue so much, but yeah, thank you very much. And we will get in touch with you for further sessions. Thank you and have a good weekend.
Have a screenshot.
Yes, if everyone could put on their videos, and we have a screenshot for all the people who are present. Oh, some people have left already. Might be too late, but for those who are around. For those who are around, if you can put on your video, and we have a photo. This is the photo that we usually have outside the meeting room when we have physical meetings.
So do I put start video or stop video?
Start video would work.